Hello and welcome to The Inn with Dr. Tim. I'm Dr. Tim Spiker, your host. The Inn really brings listeners cutting-edge topics to improve their health performance. I've been dedicated to my career in rehabilitation health sciences over the last 25 years to really advance the health and performance of others through research, teaching, publication, and direct clinical practice. Currently, I own and operate the Physician Release Therapy Institute in Ogden, Utah, a company that provides PRT instruction and certification to healthcare providers worldwide, and also direct patient care. And we are super psyched today to have Dr. Robert Huggins from the Korey Springer Institute at the University of Connecticut. We're kicking off our podcast in the Inn with Dr. Huggins with some super timely information related to the COVID crisis. And Dr. Huggins today is going to be speaking about, how best do we safeguard returning to sports and athletics, and providing us some real strategies and obviously some really up-to-date current research and expert consensus opinion. And so we'll discuss how athletes should be acclimatized to the heat and sport activity during this COVID crisis. Dr. Huggins is currently the president of research and athlete performance and safety at the Korey Springer Institute and assistant research professor in the Department of Kinesiology at the University of Connecticut. His responsibilities include supervision, management, and coordination of research initiatives currently conducted by KSI. Dr. Huggins focuses on two major areas of research: athlete health and safety and athlete performance, an absolute match for the Inn. And from an athlete performance perspective, his research interests include the heat illness prevention, thermoregulation, hydration, monitoring physiological biomarkers, exercise stress, training load, and injury prevention in soccer, football, and elite endurance athletes. He has been a lead or co-author on approximately 39 to 40 publications, including the 2013 IATF Preventing Sudden Death in Secondary School Athletics Programs, Best Practices and Recommendations document, and served on the NATA appropriate medical coverage for the Secondary School Aged Athlete Task Force. Dr. Huggins has been a licensed athletic trainer since 2007, and his research has focused on improving AT services, athletic training services at the secondary school level, emergency best practices in youth athletes, and the economic impact of medical services rendered by athletic trainers. He is the project leader of the Athletic Training Locations and Services, or ATLAS project, and Dr. Huggins has experience. He's a great clinician as well at the Marine Corps Marathon, where he has treated more than 50 cases of exertional heat stroke. He received his bachelor's degree in athletic training from the University of Connecticut in 2007, his master's in AT from the University of Virginia in 2008, and his doctoral degree, his PhD, from the University of Connecticut in 2014. And he completed a postdoctoral fellowship as well with the Korey Springer Institute at the University of Connecticut from 2014 to 2017. Now, on a side note, Rob and I go way back. Rob and I actually were colleagues and worked together, taught sports medicine and some other things at the Sacred Heart University in Fairfield, Connecticut. And so I had a great opportunity to work with Rob and see his amazing skills as not only a researcher, teacher, but also a clinician. And so I'm super psyched to have Rob on today to talk about getting athletes heat acclimatized during and following the COVID-19 pandemic. So thank you, Dr. Huggins, for joining us. And maybe Dr. Huggins, you can provide maybe a little context about the Korey Springer Institute, just for those who may not be aware of KSI and what you guys do and what we're maybe going to accomplish with some of this latest consensus and research around COVID-19.
Yeah, absolutely, Tim. Again, thanks for having me, inviting me to be on the podcast. I've worked at the Korey Springer Institute for the last 10 years since we opened our doors. And for folks who don't know, Korey Springer was an offensive lineman for the Minnesota Vikings who died of a heat stroke back in 2000. And he unfortunately was not treated appropriately by the medical staff that was present that day. Actually, a picture of him on the front page of the Minnesota local newspaper on day one of the preseason, training camp, of him vomiting on the center of the field, bent over. And when he came into training camp that year, he was a little overweight. I'm talking like 20 to 30 pounds and a 320-pound lineman already. But he was a senior, Pro Bowl tackle, on the team. So I think he kind of pushed on. And there were reports of him taking ephedra to try to reduce his his weight, because I think he knew that he wasn't in the best, physical fitness. However, nonetheless, he did suffer a heat stroke on a day when agricultural farmers were being tasked by the Department of Agriculture to bring horses and cattle indoors on the day that Minnesota Vikings were still having practice. So
that's amazing, right? Because
yeah,
we often, obviously professional athletes, football players, they're not animals, right? But we're
no,
putting animals out of the heat, but we're keeping the athletes in the heat,
right.
which is really interesting parallel, I think you brought up.
So ultimately, unfortunately, Korey's situation and his death, good came from it, and that is, in the Korey Springer Institute, which is housed at the University of Connecticut in the Department of Kinesiology, and it is run by Dr. Douglas Casa. For those of you who don't know, he is a leading expert in heat stroke, care and treatment and prevention. And he has served as an expert witness on, over 60 cases of legal, sudden death in sport, not just heat stroke, but others such as cardiac and exertional sickling and whatnot. Our institute, our mission is really to educate, to advocate, and to conduct research in the areas of, sports safety and performance. And we have a couple of different areas that we focus on, with heat stroke being our bread and butter. But one of the big things that kind of spawned this document was many look to us as a third-party organization to disseminate a cohesive kind of approach to the prevention of sudden death in sport and unnecessary injury or illness. And with the COVID-19 pandemic and sidelining many athletes for several months, we knew that this would pose a threat to the starting of organized athletics. So, many states across the country were hoping to return, as they are now, to high school and collegiate athletics, this fall. But during this period of physical distancing, we know that it's very likely that athletes are going to become or have become less active, not having access to gyms, not having access to training coaches and facilities. And while there's, administrative concerns, it's also really important from our perspective, and was the impetus behind this document, was to look at it from an injury and illness standpoint. At the Korey Springer Institute, we track the sudden deaths in this country, along with the University of North Carolina at Chapel Hill, University of Washington, and the three of us are together on a consortium to track deaths and investigate them. And what the epidemiology in previous years have shown us is that deaths are increasing, and we only suspect that due to inactivity and lack of fitness, in addition to COVID, those who've been COVID positive or have had signs and symptoms associated with it, they may have an increased risk, for injury or sudden death. Including
Right.
ankle sprains and ACL tears. So that was kind of the reason behind this document, and we got together with some really key folks, the key players: NFHS, Gatorade Sports Science Institute, the National Center for Catastrophic Sport Injury Research Center, then the NSCA, the Strength and Condition, the CSCCA, among the NFHS, I believe I mentioned, and KSI kind of championed. Oh, the National Athletic Trainers Association as well. I don't want to leave anybody out here, but apologize if I am. But we all got together to really push this agenda.
Yeah, and I everybody stop and think about this for a moment. This is amazing foresight, don't you think? Because, we're coming out of this pandemic. Most all of us have been pretty darn inactive. Here at the Institute, I can't tell you how many athletes tell me they're kind of concerned. They don't know what to do, how to return to training. And while the document that Dr. Huggins is speaking about, which will be available to you after this podcast, it's geared towards high school and collegiate athletics. However, but we have to think that the summer's starting to heat up. We're all going to be returning to physical activity, even the soccer moms with, their kids in soccer, and those of us who want to engage in running and different activities. And so I think really today, as we get into this document, we get into this really national consensus document about how best to manage this COVID return to sports participation and exercise. We probably all really need to step back and think about, are we in the best position to re-engage in exercise and sports, and how best do we need to do that so that we don't become ill, injured, or unfortunately put ourselves at greater risk for death. So I'm super appreciative that this consensus document's come out, because it really provides a guide and really a sort of some signposts for how we probably really should think about returning. Because, Rob, and you might probably agree with this, I didn't exercise for the last 2 months like I should, and is with all the gyms being closed down and athletics being closed down. I mean, how many of us are, including our athletes in organized sports, how many have really engaged in the necessary sort of activity to be ready to handle the heat, to handle the exercise? So I'm curious, Dr. Huggins, like what out of this document, what out of your research around this COVID-19 would you say puts us at risk, puts our athletes at greatest risk? I noticed in the document you had mentioned that, we might actually be putting our athletes at risk with some of these social distancing measures, which is kind of a shocker, because if you think about it, right, I mean, that's what they recommend, is to maintain social distance. So can you speak to that? Like what is it that you guys are thinking about the social distancing and how it puts us at risk?
Yeah, I think there's two types of athletes that we need to talk about here, and those are those who have had COVID, right, and then those who have not. And we can, once they've cleared COVID and have no more signs and symptoms, doesn't mean they're out of the woods when it comes to the consequences. We don't know yet what the long-term effects of being COVID positive are. We do know that there are many issues related to cardiovascular and pulmonary potential stress or stressors that we just don't know about yet. So we're kind of doing the best we can based on the information that is at hand. And there's experts in those fields that have come out with some great documents just in the last couple of weeks. But to speak to the masses that you're speaking to, we've become inactive because of the structure that is provided through sport and through going to school and being involved with coaches. And I think it comes down to resources, and then it comes down to socioeconomic status and disparities even. We had to think in this article, everyone from Division I NCAA football athletes all the way down to a high school football player in rural North Dakota, thinking about they might need to go help their families. They might need to be working right now to help them get through this because their parents lost their jobs. So there is no activity that these athletes are really having from a outdoor environmental, getting exposure to the environment, as well as exposure to whether it's strength conditioning or aerobic or anaerobic training. So we really wanted to try to address as much as we could. But the real thing here is we're asking coaches and we're asking medical staff and administrators to just be smart about this. This document is meant for you to consider these things if you haven't thought about them, thus far. We've even created a template, a COVID policy template that is located in the same spot as the document on the Korey Springer Institute website for folks to consider the policies that might need to go in place, and trying to be proactive rather than reactive to this entire approach. We know that fitness, physical fitness, is one of the biggest factors in preventing sudden death in sport. The top three causes are cardiac, heat stroke, and exertional sickling. And those three factors account for 90% of the deaths that occur in sport. When you look at football specifically, is the article that I'm quoting right now by Bowden et al. When we get athletes and keep them fit, there are adaptations that are going to cross over the different realms of sudden death. So if I get an athlete really fit, my cardiovascular stress is going to reduce because there's adaptations that take place. those cardiovascular adaptations also help when it comes to heat stroke. So if I can pump that blood around my body and I can cool my body efficiently, I'm going to reduce that risk for heat stroke as well. So these are some of the key things that we tried to focus on.
Yeah, and I would imagine, reducing this risk for illness, for sudden death, would translate as well into, other sports beyond just college and high school. And what's kind of stunned me a little bit when I read the document, and just for everyone, it's called Return to Sports and Exercise During the COVID-19 Pandemic, Guidance for High School and Collegiate Athletic Programs. Well, there's 10 million high school and collegiate athletes returning very soon to training. While there's a huge focus, and we often see like Korey Springer and others on TV, others are at risk as well. And that's something just to kind of keep in the back of mind as we talk about some of these recommendations, that those might be very applicable as well for your high school athletes, but also maybe for those participating in, community sports. Even yourself, when you're starting to think about how do I get geared up to go back to training for a marathon, or just going back to physical activity. So with that, Rob, what do you think? What do you think is more important? Do you think it's more important, just like as we move into this heat environment, to stay hydrated, or is it more important to sort of ramp up our activity in a kind of a coordinated way? It's both important. Like, what do we focus on as we start to think about moving our athletes back into physical activity?
Yeah, I think what people need to focus on is getting fit first. Okay, so there's a great document that came from the Strength Conditioning Journal that is entitled CSCCA and NSCA Joint Consensus Guidelines for Transition Periods, Safe Return to Training Following an Activity, and that's targeted for the collegiate environment, but there are many pieces from it, just like this document, that can be carried over to high school athletes or any recreationally active athlete. And I think the big thing is that, how we resume training, and people being honest, the layperson being honest with themselves about where they are at and where their physical fitness is. Obviously, having a strength conditioning coach who is certified, or an athletic trainer, or a medical staff to guide you is ideal, but that's not the case even in our high schools, right? The Atlas Project, which I'm involved with, nearly 34% of the high schools nationwide with athletics do not have athletic trainers. So they really rely on, they really
That's
rely.
Amazing. So Rob, my question, as a parent who has a child in high school right now,
Yes.
If they don't have an athletic trainer or medical personnel at the high school, who's protecting them? Who's setting these policies about how to return to sport and exercise and get fit? Who's responsible for that?
I think unfortunately our coaches are responsible for it. And, I in many times, in many situations, the coach is often an educator at the school, or a volunteer, or someone in the community that is, played football in the past and wants to coach, and may receive some training related to, proper, return to sport and return to play. And you hope that the policies within a state and the guidelines set forth by the high school athletic associations within a state and their sports medicine advisory committees to those associations are implementing policies right now based on this document that will help with this transition. And they need to disseminate this knowledge in a way that is impactful and received well by the coaches. But ultimately, parents need to step up. They need to be aware of this document. They need to go to their coaches and give it to them. Give it to their athletic director. I guess the athletic director is ultimately responsible in the school district, but they need to know how to properly, implement workouts. They need to know how to do it in a phased approach. They need to account for kids that might not have been training at all during the summer and are starting from the couch. So this document is meant to try and really focus on the high school and the collegiate. But like I said, there's a lot that the layperson can take from this going forward. But getting back, there are some kids who don't know what it's like to not be fit. They've been playing, year round, different sports, multi-sport athletes that have been playing every weekend since they were, 8 years old. And they don't know what it's like to be untrained. And this might be the first time that they're feeling that, because they don't have the structure or the organizational structure surrounding their training and the motivation that comes from being on a team with coaches and with peers. So I'm worried about that when they return, because a really good athlete, last year, top football player, let's say a tight end, thinks that they can be at the same level that they were prior to this whole COVID thing. And they're going to try their effort. They're type A. They're going to go as hard as they can. That's just in their ability. And coaches need to be able to see that and knock it down. They really need to do this in a stepwise and safe progression, because the last thing we need is another case like a Max Gilpin, in Kentucky, who was not allowed water but gave his best effort ever, and it ended up being a criminal, civil and criminal investigation. So,
well, I remember, and just as a sidebar, when I was in high school playing football and sports, I do remember that water, while it was available, was not always encouraged, or it was viewed as a weakness that you needed water. So
right.
hopefully we've come a long way since then. I know we still have challenges, but with that being said, how should it be done? I know in the document it talks about a few rules. It definitely focused on heat acclimatization, as well as
Yes.
sort of strength training. And so, can you speak to that a little bit? I guess maybe the overarching recommendations about how we should approach this sort of return back.
Yeah. So let me speak to the hydration piece first. So hydration, is critical to reducing risk and allowing the body to sweat, right? We sweat and we remove heat, right? So just like the radiator in your car, if you do not have that water on board, that engine will overheat. And our athletes some of them have, IndyCar engines, and others have diesel truck engines, but all of them need hydration to allow for blood volume to be maintained. So essentially, hydration is critical, but that does not mean that I can't drive an athlete to heat stroke, even if they're very well hydrated. So it's all about the intensity. The intensity is the biggest factor, and the environment is the second biggest factor. So making sure that we have proper work to rest ratios based on the environmental conditions is critical. And that's, outlined in our document, in that, there are many, wet bulb globe temperature, which is a fancy heat index essentially that we use, that many are actually used to nowadays, that can be calculated or looked at using a device, and it'll tell you what it really feels like on that field for that athlete. And we have different flags and different conditions. A black flag would be, oppressive heat, cancel activity. Whereas a green flag is, heat risk is low, have, activity resume as normal. And then when you get in yellow and orange and red, there's increased breaks, access to water, removal of equipment. These are all things that are going to help the athlete to get rid of that heat that's being trapped by their equipment potentially, but also with the intensity of the practice. So usually, when athletes start out, it's good to have them start out at a work to rest ratio of 1 to 4. So really, especially during the first week of training, and then in the second week of training, it can be a 1 to 3, or greater. Never a 1 to 1, like 10 minutes on, 10 minutes off, 10 minutes on, 10 minutes off. We don't want that. So
yeah. So in the context, Dr. Huggins, I guess maybe let's speak to and break that ratio down a little bit, because 1 to 4 sounds to me like about a 50% reduction. Would that be appropriate? Or
yes.
to say?
Yes.
So, for example, let's say the mom and dad who are observing their kid at high school, they're taking them to practice, and then the kid comes home there a day, and dad says, mom, chimes in, well, how was it? Did they work you hard? Oh, yeah. Dad, Mom, we sprinted the whole time on the first day. That's
Yeah.
probably and we did plyometrics, and we lifted, and we did everything, and we wore our pads, and did all
And we
kinds of
had
stuff. So
one break.
and we had one break. So that's not probably a 50% reduction. That's probably not a workload reduction.
Right.
Yeah. So more is
That's what
not
we
better,
call
I think, what I'm hearing, right? More is not
that's what
better in
we
that first period.
yeah. That's what we call the upper limit. Okay. So the upper limit is not where these athletes are right now. The upper limit is will be established later, in their training as they become more fit. But some will argue that conditioning testing must be done. Well, we just need to let folks know that if you are going to do conditioning tests, which we discourage, especially at the high school level, we would rather that they increase, their training in a gradual fashion and not have testing at the beginning. But in collegiate levels, you have the fortitude of adding medical care there. You have specific drills with specific loads and access to hydration and things like that, which can help, and places to rest and remove equipment. That may not be the case for the high school athlete in a rural location. So essentially what we're asking is, keep intensity low, okay, especially during the first 2 weeks. Allow adequate rest breaks, allow optimal hydration. And, with the hydration piece, you should be monitoring that. Athletes and parents, like, take onus on weighing yourself before and after practice. Really look at the position statements right now that show how you should replace and replenish fluids. I tell people, get naked, right? Get naked, get on a scale before and after your athletic activity. Whatever you lost was fluid. And if you drank during that time, obviously you need to subtract that weight. But whatever you lost, or add that, excuse me, whatever you lost, that's how much hydration you need to replace before your next activity. And you can't just take 2 gallons of water to the face. You really need to, hydrate over a period of time before that next practice. And what that will do is ensure that you're well hydrated. And you should really consume electrolytes, because you cannot sweat without losing sodium and chloride, excuse me, through your sweat. Water follows salt. So that's why you see that cakey appearance on your kid's face or your face after an activity. You're just dumping those electrolytes. And if you don't replace those, and Gatorade and other performance beverages might not be concentrated enough. So hot sauce and soy sauce and name it, like, get the salt in your body so that pickles, so that you can replenish those stores, allowing your engine to cool efficiently via sweat.
So let's say, the coach who's now, where we got almost 70% of coaches out there now responsible for the medical care of our children,
right,
in a high school environment. And then you got the parents kind of looking out for their kids. And so let's say, the kid comes home, he says, oh yeah, I lost, I don't know, 4 pounds, 3 pounds, mom, dad, after practice. And then the next morning, they do the hydration, and they say, well, I'm still 2 pounds down. What would you recommend? What would KSI recommend for that parent or that athlete to do if they're still like halfway down in their sort of weight?
Yeah, I think it matters on whether or not you're a 300-pound lineman or you're a 100-pound high school wide receiver. Obviously,
Okay.
2 pounds in the lineman versus 2 pounds in the wide receiver might be very different. But so kind of using the percent that someone is down is what we look at. So if you're greater than 2% dehydrated from your normal body weight, we recommend that an athlete try get down to hydrated or 0% prior to, maybe even overhydrate before the next activity. So this athlete, let's say he's a lineman and he's down, 1.5 pounds, 2 pounds before that activity. He needs to try to get some of those fluids in within, the 4 hours that lead up to his or her practice. So, consuming sodium, and people forget that there's, fluid in the food that we eat. So, watermelon and vegetables and Fruit and all of those are going to have, water content in them, but not as
Sure.
optimal as actually just, replacing that fluid via, water or sport beverage or something of that nature. So really focusing and taking an onus on getting that hydration, having a plan, I think, is the most important. So if he weighed himself or she weighed herself after that activity, saw you were 4 pounds, look at the amount of time that they have between that and waking up or going to practice the next day. Add an extra water bottle before bed. Add an extra one upon waking,
Mm-hmm.
and that'll
Mm-hmm.
really help in the long run. But one of the cool things is, as our body becomes heat acclimatized, you hold on to fluids better. So
Well,
yeah.
that's a good point. I mean, that's a really good point, and I hadn't really thought about that. So as we become acclimatized, we kind of get more used to exercising in the heat, or get used to being in the heat. We're not probably going to sweat as much, right? So with that being said, what's more important to do first? Is it more important to make sure you're hydrated, or more important to like ramp up your exposure to heat activity, or should we kind of try to be coordinating both at the same time?
So both at the same time is the key message here, Tim. So heat acclimatization is a process that takes about 10 to 14 days for the full adaptations to occur. And when I say adaptations, I'm talking about my heart rate is reduced at a given intensity. So as opposed to being at 180 beats a minute, I'm down to 170
Mm-hmm.
at the same exercise intensity in the heat. My core body temperature, how hot I am on the inside, is down a degree Celsius, right? My sweat rate, actually, you said something that sweat rate decreased. Sweat rate actually increases when you
Mm.
are heat acclimatized. So you are a more efficient sweater, though, because the content of that sweat has less sodium in it. So it evaporates more readily off that microclimate that's created on your skin to cool you. Another thing too is, another adaptation that occurs is, like I said, that sweat rate, and then your thermal skin temperature actually goes down as well. So when skin temperature is down, we feel less hot because all of our sensors, our thermal sensation is in our skin. When our skin feels really wet and humid, you feel really hot. But if you're in a dry climate like in Arizona or hiking in the mountains, that water that has evaporated off your skin, you don't feel it, and you feel less hot, even though you are just as dehydrated and just as hot. But it's just a way that your skin is giving that feedback to your brain. So, what we recommend, and what most high schools and colleges, NCAA has mandated this already, and as have many states, is there is 7 days that are specifically dedicated to phasing in activity in the heat. And those are policies that the Korey Springer Institute has actually worked in concert with the NFL and the NATA, National Athletic Trainer Association, to go state by state and work with them on these policies, to look at their policies, track them, which we do, and identify areas of improvement when it comes to
Mm-hmm.
heat acclimatization specifically. So,
Let me ask you
yeah,
this. Can
yeah.
I ask you this real quick? Because, we're here in Utah. However, we don't get like the crazy heat and humidity like the South. That being said, I'm concerned that maybe parents or coaches, like in an environment that's in the North, be like, oh, I don't have to worry. I don't have to worry about heat acclimatization. And I don't have to worry about really ramping up, the right work rest ratios because it's kind of cool. Is that like faulty thinking, Dr. Huggins, or is that correct? Or is there modifications based on location?
Yeah.
What's the thought there?
So yes, it's a massive myth, and one of the kids that I'm worried about the most are those in the Northeast, and those who do not have routine and regular outdoor exposure to the heat like those in the South. So your body is constantly adapting to the environment that it's been in for the past 3, 5, 7, 1 month. Those the days and months that you live in and you reside in and that you train in. So there are
Mm-hmm.
region specific environmental wet bulb globe temperature, which I mentioned before, modification guidelines that are specific to different regions of the United States for medical folks to and coaches to follow and implement. So again, it goes back to monitoring that environment and making sure that it's, because like a 90-degree day for a kid in Connecticut might feel pretty darn hot for them, right? Training on a football field, whereas a 90-degree day down in Georgia is like full out, let's go. Practice is on, games are on. There's no issues because these kids have been used to that and they've become acclimatized in that environment. So, that is a big myth, and people need to know.
So in a way, it sounds to me, and correct me if I'm wrong, it almost sounds like maybe those in more northern environments or, not in Georgia might be a greater risk to have a adverse, sort of effect to happen to them when they're kind of returning to this hot summer environment.
Yeah.
Would that
yes,
be sort of?
I would agree. And I think, we're more apt to have those spikes in temperature, especially early on in the spring, like we see at the Boston Marathon. Some years it's cool and raining, and other years it is 86 degrees in April, and we're dealing with heat strokes and heat illnesses in the finish line medical tent. Same goes for late fall, as well with the Marine Corps Marathon, which we see all the time at the end of October. Some days are rainy and cold, and other days the radiant load and the heat jump up. So, my biggest concern is those in northern states, going down south or traveling. I think of elite athletes, right? Ironman and those who are marathoners who are going to events down south. When those events will return is to be determined. But I worry most about those who go down to Mexico for an Ironman event or go to Hawaii, and they're just not used to that heat and that humidity.
Right.
Plays a big role.
Well, we definitely have a lot of that here. We have a lot of people traveling to different marathons and different sporting events all over. So what's amazing to me, and I don't know if parents have really or coaches even have got their heads wrapped around this. So at minimum, we're not really even ready to go at full go in a heat kind of based environment for 7 days minimum, maybe 14. It's going to take us a full 14. So once people get there, Dr. Huggins, like, do they need to do anything else? Like, or are they good to go? Okay, I've spent my 14 days ramping up my activity and doing my 50% load on the first week and my 30% load on the second. So I'm good, right? I'm good for the rest of the season. What would you say?
So, it depends on, again, your environment and where you train on a regular basis. But if you want to hold on, there's a great bit of research out there now about holding on the decay of heat acclimatization and how we hold on to those effects and those benefits. So what one study had found by Pryor et al., I think it was back in 2015 or 16, they found that if you train once every 5 days in the heat, that you can maintain 80% of those adaptations, even 1 month after you've obtained them. So, I think of the soccer teams in the Northeast, for example, who, preseason, they're dealing with the heat. September starts to get a little bit cooler. October, now we're getting much cooler, but yet, NCAA championships and other events are all down south come November and December. So, what we actually do with one of our teams is we try to expose them to the heat. Our cross-country team, we brought men's and women's athletes into our heat chamber once every 5 days to help them maintain the adaptations that they formed on their own through exercise in the summer. So, we try to hold on to those adaptations, because someone who exercises in the heat not only performs better in the heat, but you perform better in cool environments as well. So you're always better off. It's like natural, blood doping, so to speak, in that it's a legal ergogenic aid, and it's a natural, thing that one can do to either create that artificial environment in their home or, put extra clothing on, but during exercise, but you have to do it safely. And I want to really stress this, that you need to get your core body temperature when you're doing this and exercising in the heat to prepare and advance your ability to sweat and to keep your core temp down, and deliver oxygen to your tissues and to your skin. So you need to measure your core body temperature. And unfortunately, the only way to really get an accurate measure for all those medical folks out there, this is nothing new, but is a rectal thermometer. Without doing that, an oral, in your mouth temperature or ear temperature devices, those are great at rest, but they are horrible when you are actually exercising, because your organs are getting really hot, and the only way to really get an accurate temperature is inside the body. So I've had many elite Ironman athletes and others who don't perform well in the heat make their own, laundry rooms, and they're, wearing extra clothes. But the caveat is they have to take their temperature every 20 to 30 minutes for me during that time, so that they can be safe, or ideally be observed by a, athletic trainer, physical therapist, someone trained who knows and how to interpret core body temperature.
Yeah, that's a pretty good point, because that was what was running through my mind. I'm kind of thinking, as a parent or as an athlete myself, well, maybe I should just go sit in a like sauna for hours and put on, like my rubber suit and things of that nature. But then I started thinking, well, maybe I might get heat stroke if I do that.
Yes, and there's been countless articles of people passing out in saunas. Wrestlers and boxers wearing additional, non-permeable clothing. And those things have their role. You just need to do it in a safe manner, and, be with someone else, especially when you're going in a sauna, or train with others, so that you don't end up in a bad situation. But ultimately, taking your core temp is the best. And, if you want to see the adaptations during heat acclimatization, the most optimal are using what we call a recent study by Dr. Courtney Benjamin and Dr. Yasuki Sekiguchi, two PhD students of ours from this past year. They coined the term, hyperthermic zone heat acclimatization. So what they do is they actually bring the patient or the athlete up to the zone, the highest possible zone that they can. And when I say that, that's like between a temperature of 104 and like 103 degrees Fahrenheit, right? Most people might be shocked that I just said that, but a normal exercising athlete is between 102, 1015, 102, and 104. That's where most body temperatures are during an athletic event. And our body gains that heat really quickly. But what Dr. Benjamin and Dr. Sekiguchi did is they brought these athletes in and intentionally jacked their temperatures up to those hyperthermic levels and kept them there for 60 minutes a day for 5 days. And in 5 days, they saw massive adaptations beyond normal heat acclimatization of these regularly running endurance athletes. They saw added benefits of doing it that way, which were profound. So you have to do it safely is the moral of the story here, and you need to know your core temperature. And some will say, okay, I can't exercise for an hour. I want to exercise for 30 minutes, but then can I go in a sauna? Yes, you can, to kind of keep that heat dose or that heat load that you're trying to get your body to adapt to, without getting the stress pounding from running or overtraining and lifting and muscle damage and things like that you don't really, that's not the desired effect. We do recommend folks, wear extra clothing, or use a sauna as a supplement, or a hot tub as a supplement to their heat session. But to really, you got to do so safely, because you don't want to end up in a heat stroke situation.
And it kind of, it's very applicable to this COVID situation right now, because we just had a massive jump in cases. We went to like a yellow level, but now they're talking about taking us back to a different level because there's rising cases and deaths. So what I picked up on the article, which I didn't think about in context of that, is that let's say the state or some other organization shuts down training again, or shuts down sport activity. Yes. And then athletes are out doing nothing again for several weeks. And what I saw in the article, which kind of like just made me think about this COVID, sort of break and start thing, was that you might be acclimatized and you're good to go. You've gone through all that heat acclimatization, you're hydrated, you're fit, and so forth. But then you take off several weeks because things get shut down. Then you got to start all over again.
Yeah.
You got to reacclimate. Am I reading that correct? Because that's pretty
Yeah,
amazing.
that's correct. So, I mean, again, it depends on the environment that the athlete is training in. But if you get shut down for 7 or more days, you heard me. You have to train once every 5 days in the heat to hold on to these adaptations. Well, if you don't train for approximately 14 days, you lose all of the adaptation that you've gained. So, we've asked schools and organizations and at the collegiate and NCAA level and state levels to really reconsider how that phasing in occurs again if there is another break that is needed. Say you get a COVID positive athlete on your team, and now the team is prohibited from participation against other teams. Like, what's that process like for that athlete specifically that now has COVID? What's that process like for the other athletes? What are the sizes of the groups that can at least keep training together in using physical distancing during training, in smaller groups that are spread out, but you'll yet still be, organized with, training sessions with a coach or without. So yeah, essentially the heat AC process would need to restart, prior to the resumption of activity. So, for that team that has been, kind of banned, I guess you could say, from participation for 2 weeks, you might as well add a third week for them to get back into physical fitness and heat acclimatization status before they can return.
And I would imagine, Dr. Huggins, similarly, for even the individual who has been quarantined or who is looking to get back to physical activity, because, to be honest with you, I got the COVID-15. I gained 15 pounds sitting at home and my wife baking, doing baked goods all the time. I mean, I want to get back to it. I want to lose weight. I want to do it quickly, right? We all do, don't we? And so, even the individual, kind of what I'm getting from the take home, yes, athletes, maybe a third of our athletes in the high school environment are pretty well managed and we have medical services there. But it's really going to fall on us to be educated about how to return safely, how to return our students, our children safely, and kind of, I guess the big nuggets, what I'm hearing is we've got to watch our hydration loss or water loss at 2%. And we got to really want us to sweat more as we become more fit. We need that heat acclimatization sort of time period. It needs to be smartly done. And with that, we need to reach out to a healthcare professional that has experience in this area. And obviously the resources that KSI provides and with this document are going to be incredible to kind of set the stage for us to return to athletic activity and exercise in a safe manner. Now, with that though, is there other kind of key things that I'm missing there? Or do you think that that's the sort of the nugget of what we should be thinking about as we start to think about re-engaging after this COVID period?
I think, those are all correct, Tim, and you're correct in interpreting many of those. There's a few other aspects of this document, though, we've, not really mentioned yet that I think, people should just, if you have a chance to read the document or to look at some infographics that we've produced, for the medical provider and the parent, there's a whole 2 sections here on physical evaluations and past medical history. We're going to have big issues with many of us know that our high school athletes and our collegiate athletes are required to have a physical prior to athletics for clearance purposes. Well,
and many in competitive sports, right? Or
AAU
sports,
and Premier Leagues and Olympic development leagues and things like that all require physical exams for the safety of the athlete. Well, now there's a whole nother set of potential areas that the physician or the medical provider needs to delve into when it comes to COVID. And considering also the logistics of getting that exam. So if offices are inundated still, or they have stay-at-home orders and the telemedicine and all of these things need to think about the way that we encounter these athletes now, how we follow up on chronic conditions that might pose someone at a greater risk for COVID. Those with COVID, how are we going to make sure, that they're screened appropriately? Are they getting screenings for, their heart, for their lungs? All of these things, looking at cardiac biomarkers, HS troponin is an example that we mentioned in the document, but there's specific guidance in a publication by Aaron Bagish et al. Specific to the cardiac and electrocardiogram or ECG testing that physicians are going to have to think about. Kidney function and damage, kidney biomarkers. Those with respiratory symptoms are going to have to, get some pulmonary testing done. But again, this all is guided by the physician. So parents and athletes need to be advocates for themselves and be true to themselves about what, they're feeling internally that could potentially be a COVID-related issue, especially if you've been in close proximity, to an individual who has had it. So oftentimes it's a perfect storm that occurs. So let's say we have a COVID, potential COVID issue. The kid hasn't been training. The coach or the program is not well vetted. It's in the heat. They're not hydrated. That's the kid that's going to unfortunately succumb or die or end up in a bad situation. So we have to address as many of these areas as possible. And that was the point of the document, is to make sure that we are, preventing it, that we are addressing the external and internal factors, to the extent that we can, and that we are ultimately just being smart people during this phasing in. We cannot, as much as we want to, we cannot go right back to where we were before this. It is going to take time, and coaches and athletes and medical staff need to be extra diligent and professional, and not be excessive with their requirements. And ultimately, we're going to save the lives of these kids and or long-term, disability in some who have heat stroke that do survive or what have you. Just that's the moral of the document. But one last piece, if I may, is that the education is key. So we call upon, those that are in administrative positions or in a position of authority to have a plan, to have an educational plan, to disseminate your plan going forward with keeping COVID in mind. It is not business as usual. We need to have a point person. So whether that's a parent advocacy group, whether that's an athletic trainer, whether it's a physician, whether it's a coach, whether it's an athletic director, that point person needs to disseminate this information. It might be following state high school athletic association or collegiate NCAA guidelines that come out. But someone needs to keep a close eye on what those guidelines and recommendations are, deliver it to the target audience in a mode or modes that are going to be impactful. And then think about the timing of this, right? The timing's going to matter. And you might need to revisit those recommendations to make sure that everyone is on the same page. And those are some of the key things in terms of the implementation and adoption that is imperative. We could write about this and talk about it till we're blue in the face, but if we don't deliver it in an effective way to the end user, it's going to fall on deaf ears.
So I think probably that's the most critical point. I mean, to me, right? Because we can be aware about all this, but if it's not happening, if we're not implementing these things, if we're not protecting our students, our children, ourselves, it's not going to matter, right? So parents out there, coaches, others, please ask your athletic director, your sports teams, your community leagues, your school board, do we have a plan? Do we have a COVID return to activity, to sports participation exercise plan? Well, fortunately, KSI has provided that for you to a large extent. And we're super thankful for them and super thankful and grateful for Dr. Huggins and all the work he does to protect us as human beings and also our children and athletes. around the nation. So with that, Dr. Huggins, where can people find you? How do they get in touch with KSI? How do they get in touch with you? How do they find you?
Yeah, so best place to go is our website, and that is ksi.uconn.edu. And you'll see on that webpage there's information all about different emergency conditions, prevention, research that we're doing, services that we offer to athletes and to those who may have suffered heat stroke or near-death experiences in the past that are trying to get back to sport. That's a whole nother aspect that we didn't even talk about here today, Tim, was, return following a heat stroke or an illness related to exercise in the heat. But, we talk about all of that on our website. There's some great educational videos and tools for everyone, mostly for, parents and for sports medicine personnel. So please take a look at our website. We are also, on Twitter, Facebook, and Instagram as well. So if you'd like to follow us there on Twitter, we're at K_S_Institute, and you'll see we tweet out a lot of infographics and information, just key things related to health and safety and performance in sport. So please, follow us, and we're here. You can call us. Our main office as well, and we always try to get back to people as quickly as possible if they have an inquiry. And we're here to help, and we can help advocate for you in your community. Oftentimes, having that third-party expert come in and be a voice of reason for you on what the rest of the country is doing or what is best practice can go a long way. So we are here for you to do that, and we do that all the time. So
awesome. That's great. And I guess my last parting question, Dr. Huggins, is what impact does maybe you and KSI want to have on humanity?
The big impact is we just want athletes to play and learn and grow in the sport or job or in the military, whatever physical activity setting that you're in. We just want folks to do so safely. We think safety is the most important aspect of any activity that someone embarks on. And, we want to just be known as the resource and the place where research and advocacy for what is right and what is safe and what is healthy during exercise, and physical activity, we want to be that place. And we want to help healthcare providers be that one-stop shop for, what's best practice and how to treat and how to keep athletes from dying or from, illnesses, but also to maximize performance. There's performance and safety kind of go hand in hand, right? If you optimize safety, you're also going to improve performance. And if you optimize performance, well, you're probably going to improve safety at the same time. So that's what we try to do. And athletes, soldiers, laborers, any physically active individual, we want to help them, perform at their best.
Simply awesome. And thanks so much for your contribution to humanity. I think folks out there, we've lost enough lives to COVID, and we need not to suffer any more loss by improper training, improper return after COVID to exercise and athletic activity. So we hope that those out there listening to this podcast will take hold of this document, will implement these recommendations, and will be an advocate for the high school athlete, the collegiate athlete, the community athlete, yourselves within the environment, and look to your leaders and administrators to make these changes and put these plans in place to save lives. Thank you very much. And we look forward to having you on another podcast in the future, Dr. Huggins.
No, thank you, Tim. I really appreciate it.